All right, that's kind of a thrill ride, but, if just trying to get up and walk across the room is a thrill for you because your feet hurt so bad you don't even want to do it, let's see if we can get that taken care of here this morning. Get you back to that active lifestyle. Dr. John Krage is here. The program is Happy Feet. And, Doctor, you couldn't have picked a better name for this thing. You want everybody to get happy again. You want them to be happy to get up and get active.
Yeah. One of the sad parts is when they come in, they're not really that happy. So the fact is, when you lose that ability to have the quality of your life, past the age of 50, all of a sudden things start to change. And a lot of our people are pretty upset with the fact that they're having problems just getting from the car into the office and really worried about what's going to happen in the next couple of years. So if those feet are really bothering you and the pain is there and it's not going away, please do something about it before it really gets into a pathological state.
Okay, let's talk about that being our number one message today is the doctor just wants you to do something. And he's so adamant about this that he's happy to have you come into the office for the first 25 callers, get a completely free exam, 2 free laser treatments. And again, this is non-surgical. It doesn't involve any cutting. It just involves healing. So 2 free treatments and a complete free exam for the first 25 callers. So I hope we've got your attention with that. Now let's talk about who this applies to. And the broad spectrum is kind of startling.
Well, frankly, at some point in your life, about 80% are going to be laid up because of foot disorders, okay? More importantly, you need to understand it's third leading cause of death to the aging population.
This is falling, and bad feet contributes to that significantly.
It's the primary reason. Now, here's the lady. Look at her right foot. Notice how it's the toes are pulled back. Those are secondary to neuromas. She has 3 failed surgeries, Mark, on that side.
But now the other foot looks pretty good.
But that's the key. The reason the right one is bad is because the left one actually has a worse problem at the heel. So every time it's kind of like having an attack at the heel. She puts her weight immediately onto the right side. Now, the point I want to make is we've now repaired the left side, and she's 60% better without any additional surgery. But more importantly, I would have liked to have gotten her before all of that surgery, Mark, to get her on track, okay?
And that's the message here again, folks. First off, to get you to do something today and to help you avoid surgery. Now, if surgery ends up being the only option in the end, the doctor's going to tell you that. But you're able to help roughly what percentage of people non-surgically?
Well, frankly, there's no risk for these 2 laser treatments. And if that starts to get you better, you have a 90% success rate of getting this all taken care of.
Without surgery?
Without surgery, so-called.
Now, these surgeries, they fail at an alarming rate as well. And I think, anybody that's had multiple surgeries, you can still see them.
Well, these are like bunion surgery. Although they're able to straighten the toe and make it look pretty, they never correct why it's bent. We have an airline stewardess, they cut her 3 times, and 3 times it rebent. So if you don't take care of these alignment disorders and why the foot is actually in that bent state or pointing towards the little toe, you never really, it's kind of like an alignment of a car. If you don't get those new tires with alignment, they still wear incorrectly.
So folks, again, for the first 25 callers, the exam is absolutely free, no obligation whatsoever. The 2 free laser treatments, and what you're looking at here is how bad this can be after failed surgeries. And Dr. Krage may still be able to help you despite all of this. So, I mean, that's a pretty positive message, and I know you feel so strongly about this. You just want people to make the call. Come in and see it. It's not going to cost them a nickel.
Everything you're seeing there can have been obviated, the surgery, postponed that, potentially for life, if we'd have just got to them before they'd had that surgery.
So you fix the alignment, but then you have to heal it, and that's where the laser treatment comes in. And I want people, you hear laser, you may think cutting and so forth, you may think hot. It's not that at all. It's totally non-surgical.
Well, it's scientifically based, and we have 5 lasers now in the office. These are class 4 lasers. Feels like a warm massage over your foot, okay? Women love it there. They would just say, just leave it and never take it off because it produces that warm heat. And frankly, the foot gets cold. It's because it's the furthest away from the heart. It's one of the main things. But ultimately, it heals the tissues by about 4 to 5 times normal. And you're literally going to see a reduction in pain of 30 to 50% in those first 2 treatments.
So folks, this is the key to the whole thing is to get you in there, to get you off the couch, out of your chair, get you down to the doctor's office. You can make the call on behalf of somebody else. If it happens to be a loved one, a spouse, a friend, make the call, make the appointment, and get them down there. It will not cost you anything. And again, after a couple of treatments here, you're going to have a very good idea of whether or not this will work for you.
No, you'll know it, and it's so. I just this week I had walked in yesterday. Someone from the sheriff's department, won't tell you who that is, but she said, I said 5-10% better. No, she said it was 30% better. I went, great. Now the sad part about it, she had waited like a tough law enforcement person until the toes had literally pulled all the way back.
Oof.
Now, she could have done something about that much sooner, Mark, but sometimes we just got a little hard-headed about moving forward, making that choice to get this taken care of now.
All right, Dr. John Krage, it's Happy Feet. You get down there to see him. Again, the first 25 callers, go ahead and call now. The line is open. Won't cost you a thing for the first exam and the 2 free laser treatments. And again, you'll talk to Dr. Krage, and he'll explain the entire program to you and let you know whether or not you can be helped. But again, the percentages are on your side, but you have to make the call. So please do that today. It's good to see you, Doctor.
You too, Mark. Thank
As
you.
always. All right.